Healthcare open enrollment is not over, and if you're in need of some help for your 2026 health insurance, now's the time to take a look at it. Hi, it's Tommy at medicalinsurancetoday.com. So I want to talk about two categories, our primary focus of insurance. We work a lot in the individual and family plan market. That includes Covered California, all the direct off exchange plans going direct to the mainline insurance companies. And for the under 65 market, it's been a really rough season for a lot of people. The rate increases have been crazy in California and nationwide, and also with the loss of subsidy in some cases in Covered California, that's caused a lot of people's premiums to jump up, myself included. My insurance has gone from $1,000 a month to over $1,750. So it's a big jump, a little over $8,500 for the year for my family alone. So I feel your pain. I am a realist and very open to the reality of what's going on in healthcare. And my job is to help people find more affordable insurance or make sure that you guys are in the right plan. So we would love to help you. To talk in detail a little bit about that, rate increase across California, county to county. Each county reports their rate increase. And as an aggregate across all the companies and all the counties, the rate increase is over 10% for the year in California. Now that is over double what it is on average since the Affordable Care Act went into effect in 2014. On average, it runs 4 or 5% aggregate across the state. Now that 10%, people say, well, I wish I got a 10% rate increase because my rate went up way over 10%. And a lot of people are seeing rate increases that are well into the 100% range, prices doubling in effect. So it's a little bit misleading, that 10% number, because it comes down to dollars and cents. You know, what can you afford? Where's your budget? Now in the Covered California market, that's going to be the most affordable route. If you're not a high earner, that's going to be the most affordable route for the same health insurance that's out there. So if you were to go shopping today, come and talk with our office, Medical Insurance Today, or you call 10 agents or call all the insurance companies and want to spend that time on your own, I highly encourage against that. Find an agent. It doesn't cost you anything. And the prices that we quote will be identical to what you find online and with every other agent that you call. So insurance is a very fixed market, I like to say. There's no need to shop. You find one agent that knows their market and the prices are the same anywhere. So feel at ease when you do talk to an agent that you don't need to spend a whole ton of time on that. Now, regarding the marketplace, you have tiers of bronze, silver, gold, and platinum in the individual and family plan market, or under 65, I should say. So if you're buying insurance under 65, you're on a bronze, silver, gold, or platinum tier. If you are on a silver, gold, or platinum tier, the first step to look at is moving down a tier to lower your monthly cost. Depending on the size of your household and your age and the age of the people in your household, that'll save you $100 to $300-400 a month. On average, for a single person, is going to save you $75 to $150 a month to move down a tier from a silver to a bronze or a gold to a silver, etc. So that's something we can investigate for you. You need to be cautious with the bronze plan. A lot of folks are moving to bronze. As long as you're aware of the high deductible and the catastrophic nature of a bronze plan, that can work and it will save you a bundle of money. If you utilize your insurance a great deal, you might not want to go to a bronze because bronze will have higher expenses. Silver's kind of the go-to. So if you're on a gold or platinum plan, you should definitely look at moving down to a silver plan, most certainly. Second option for savings under age 65 is to move from a PPO to an HMO. That is going to save you a bundle of money. PPO has become a luxury item now. That is a phrase I've coined for folks in the PPO market. PPO is expensive and HMO is much less expensive. And I've had a significant amount of people this year that have historically and only been clients that would say, I only want PPO health insurance. I need to have choice. I need to keep my doctors. And I've helped countless number of people this year, this last season in the fall, and during this open enrollment, move to an HMO type plan and help navigate that. And what that means is coordination of doctors, talking with you about your doctors, researching what those doctors accept. I've had a number of people that have had to switch doctors, unfortunately. If a PPO is going to cost you $2,000 and your HMO is $1,000, which is about the spread that you're going to see for a family, that's $12,000 a year in terms of healthcare costs. Most people, unless you have significant health issues or you are just committed to that doctor, can change a doctor to save that premium. It's definitely worth considering on the step down. And we can help you do that, help you to navigate, know exactly the doctors that you would have access to, talk to you about who the specialist would be and the networks that you would have access to within these companies. Now, let's say you're on a silver plan already and you don't want to go down to bronze. You say, well, I'm willing to go to HMO and I need to know who the doctors are. How will that work? Who will I be able to see? And that's something our staff is very adept at. Our skill set and our knowledge base about the companies and the doctor networks affiliated with the companies is our area of expertise. We can help you through that. If you're looking at this saying, God, I don't know how I'm going to afford my insurance, which I've had that conversation too many times this season, that is something we can walk you through and at least give you a roadmap of what would be available to you in the event that you say, I need to move and I need to save some money because I cannot afford my insurance. And I'm unfortunately having that conversation too frequently. Moving to Medicare. In the Medicare market, we had a big shift this year. Part D drug coverage plans changed a bunch. PPO Advantage plans effectively moved out of California. There's only a couple few left pending the county that you live in. So if you're in that Advantage plan market and you're in a PPO, there's still a couple players out there depending where you live. In certain counties, there are not any PPO Advantage plans. That has caused a lot of uproar for a lot of people because the PPO Advantage plans are very appealing, but these insurance companies have pulled out in a lot of cases of specific areas and regions and demographics to save money. They wouldn't pull plans out of the demographic or a region if it was profitable to them. So that means these insurance companies are losing money on those policies. So in those regions where the PPO Advantage has left, you're going to be left with an HMO Advantage plan, and then the alternative, which the other side of the coin, I like to say, which is Medigap. Now, if you are on a PPO Advantage plan, you were typically enticed into that because of a low premium on a PPO. The PPO Advantage plans typically have a zero premium to them. There's no monthly cost. When that goes away, the next step is to go to an HMO Advantage. So we need to have that discussion again about HMO and PPO. Can you go to an HMO? Will the doctors line up? Will the doctors work for you? If they don't, we're very adept at what Medigap offers. Medigap is traditional fee-for-service Medicare supplement. It comes with a premium. Depending on your age, if you're 65, that's going to run you $170 to $190 a month for a top level G plan, and can be higher, but that's at 65. If you're 75 or 80, that $170 premium becomes $300 or $350 a month. So that's something to measure in terms of cost, whether that's affordable for you. I've helped a lot of folks that have been traditionally PPO and helped them navigate into an HMO Advantage, which is extremely appealing on the cost because there's no premium for the HMO Advantages and you pay very, very little out of pocket when you use that coverage. And we leave the choices up to you. You know, we're here to lay out the options on the table, discuss them, help educate you and inform you as the consumer. We do all of that work free of charge, and to help you make the right decision for your healthcare and continually help you manage that healthcare into the future. So every year we're talking to our clients from September until this time of year to help you manage it year over year. So as things change, healthcare is going to continually change into the future. If you need an agency that's reliable, that will call you back, that returns calls, responds to emails, and is proactively looking to serve and to help our clients, Medical Insurance Today might be the place for you. So if you're in need of help in any of these markets, under age 65 and Medicare, please reach out to us. We would love to help you. MedicalInsuranceToday.com, and we look forward to serving you.